Hi, I'm Liesl Perez, co-founder of Access Integrated Mental Health. Welcome to the clinic. I want to tell you why we founded Access Integrated Mental Health. When my children were younger, they got diagnosed with ADHD and anxiety, and I actually didn't know what to do. I didn't know the difference between a psychiatrist, a psychotherapist, and a psychologist. I also didn't know what my insurance would pay for and what it wouldn't pay for. I thought to myself, surely there's a better way of doing this. It turns out there wasn't. So we actually had to create it ourselves. And thank God, because a few years later, I became a patient as well. Here's what's important to me about mental health. One, we need to have empathy, we need to have cutting edge treatments, and we need it to be accessible. Here's how it works. At Access Integrated Mental Health, we actually combine psychiatry, therapy, and advanced treatments like Spravato and TMS all in one location. Each TMS session usually lasts about 30 minutes. It's about 20 minutes on the left side and 10 minutes on the right. And that's it. All you really feel is like tapping on your head for 20 minutes, and that's what the experience is like. We've never had anyone have any adverse reactions to. This is the Spravato applicator, and it's basically a nasal spray. All you have to do is spray it into each nostril and wait 5 minutes for the next applicator to be prescribed to you. That's it. That's the entire treatment. And then you relax for 2 hours. In the second week, if you tolerated the first week okay, we'll give you a third applicator as well. Spravato normally takes 2 months of treatment. In the first month, you're coming in twice a week for 2 hours at a time. In the second month, you're coming in once a week for 2 hours at a time. After that, it's really up to you and your prescriber to try to understand what's the right cadence for treatment. We always recommend that you come in before you crash. For some people, that means they're coming in every other week. For other people, they're coming in once a month. Just depends on how well you respond to treatment and what else you're doing outside of the treatment room, like therapy or TMS.
The most immediate thing that I felt was wanting to be alive. I have wanted to be gone since I was 4 or 5 years old from this world.
I am profoundly a different person today than I was a year and a half ago. You created something that finally helped me. It all ties back to one common denominator, and that's what Access is created for me to take part of.
You guys saved my life. So thank you.
Here's how you can see us. All you have to do is book your first intake, which is 60 minutes long online. Booking is very easy. At your first intake, you'll be talking to a psychiatric provider, and in 1 hour, you can co-create a plan that works for you to reach your mental health goals. That may include medications. It may include advanced treatments like TMS, which doesn't require any medications. It may include securing your transportation plan to and from treatment, and it may also include therapy. There are a lot of different ways that we can manage your mental health, and we need you to tell us what your goals are and what your limitations are. So that's it. That's our clinic. Remember, mental health is more than meds, and whether you need psychiatry or therapy or advanced treatments for depression and anxiety, we got you.